And then we go to sharing the screen. And so today we are going to parents and young children. So, and how to deal with them in the medical practice. And so I would like to make it full screen. So can you see it full screen?
No, ma'am.
Yes, ma'am.
No, ma'am, not
Yes,
now.
ma'am.
Is it full
No,
screen?
ma'am.
Ma'am, I see full
Not
screen,
full
ma'am.
screen. Not full
Ma'am,
screen.
I see a full screen, ma'am.
I see. You just
Yeah, ma'am.
your technology is better. But so I
Thank you, ma'am.
just one more time. Okay. What about now?
Yes, ma'am.
Yes,
It's
ma'am,
full
now we
screen.
see.
Yes,
Everyone
ma'am.
can
Now
see.
it is physical.
Nah, ma'am.
No, not yet.
Yes, ma'am.
Yes, ma'am. Dada.
Yes.
Vandana ko
Good.
dekho.
Well, now I would like you to focus on the pictures here on this slide. So what is happening in each picture? So you can see children, and I would like you to focus on the interaction between children and adults. In picture A, where are the people? What is happening there?
This picture looks like a situation where like the ambulance is being outside the hospital and the
Mhm.
child is with its parent, or maybe we can say the caretaker over there. Maybe the parent is admitted in the hospital, or even the child may be sick and she or he is taken to the hospital.
And how does the child feel?
Scared, of course, scared, curious. Curiosity is also
Curious.
something.
Okay, so is the child at ease? Is it does the child feel safe?
I don't think so. It's very rare for a child to feel safe in a stranger's hand. If it's a
Okay.
parent who is holding it, then he or she will feel safe. But if it's someone else, then I don't think so. It will be safe.
Yeah. Yes. If it is his mother, so he'll probably feel safer. Mhm.
May I interrupt?
Yes, please.
Ma'am, we can see the child is holding this woman very firmly. I mean, in a very closed contact, ma'am. So we can say that child is feeling safe. Because if he wouldn't be feeling safe, he would stay a bit away or wouldn't hold her like this, the way he's holding.
Mhm. Yes, yes, I agree. Well, and in picture B, where are the people and what is happening?
Ma'am, it's a medical
Ma'am,
ward
people
in
say
the hospital.
in the
Yes,
hospital.
Vandana, please. Vandana. Mhm.
Ma'am, they are in a ward in a hospital. It can be a general ward or a children's ward. And we can see the environment is environment is at ease there. Like we can see the child playing. I think it's it's tablet or laptop. He's doing his work. Even the parents look calm. They are listening to the doctor.
Mhm. Are they in the hospital or at home?
I think
It looks like at home.
A hospital bed. It looks like a
it can be a
hospital bed,
children's
and
ward, because even in children's
Maybe.
ward, the atmosphere is very friendly to children to feel at home, at ease, to feel safe.
Mhm, mhm.
Because
Okay. Mhm,
yes.
mhm. Thank you. So, yes, and the child is just relaxed and feels comfortable. Okay. Mhm. And so if we have a look at these pictures, so picture C, what is happening there?
Like in the first photo, the child is very scared of the injections.
Mhm. So he can see the syringe. That is why he's scared. Mhm. And
Yeah.
what about his mother? What's she doing?
he is
Mother is
trying
trying
to
to calm his down.
Mhm.
Him down.
Yes. Okay, so let's move to picture D. What is happening there?
In this picture, we can see that the doctor is discussing something with the parent, and the child is not feeling well, so he has been given a special chair to sit. And
Parent is calmly listening to the doctor about the seriousness of the case.
Ma'am, may I?
Yes, please. Mhm.
May I?
Yes.
Ma'am, according to me, the child is specially abled because we can see a few different posture characters placed on the on his body as well, ma'am. And the chair which he's using is also for specially abled. I think he's facing issues while walking and all. We can see a catheter also at his hand. So I think, ma'am, they are actually discussing about some serious innervation with his neural issue. I mean, this child is suffering from some neural issue, and they are discussing something to actually work towards it, ma'am. Doctor, the counselor actually, not exactly doctor here, ma'am, and the patient. Sorry, and the parent.
And if we look at the child, what helps him to relax here in this situation? So you can see
Ma'am,
Ma'am, we can see a toy car
parent.
there,
toy car. Yeah. So just
Yes.
Parent and toy car.
just to distract him from the environment or the seriousness or any kind of difficulties facing right now. So there
exactly.
is a car we can see there and maybe playing with it or just having it there. He feels safe or calm.
Right. Okay. Thank you. And picture E. What is there?
Ma'am, the
And we can
patient.
see the
It's a very
Ma'am,
serious
patient is
photo.
very serious matter. And ma'am, like his or ma'am,
guardian
like
of-
her brother, guardian, like are very depressed, as we see in the picture. Yeah,
But
ma'am,
anyway,
critical situation.
The next to
He's
kind.
staying next to the bed
Yeah.
just in
Yes, ma'am.
case the child wakes up and
Yes, ma'am.
his,
And
his
we can
mother
also
is.
see that, ma'am, the patient is on ventilator because we can see the machines and the oxygen supply going through the nose. And also through
maybe he's
trachea.
very serious or in coma right now, coma state.
Yes, ma'am.
Because from the reaction of the guardian, we can say.
Well, you see that
We can say there's a head injury.
yes, parents just support is very
Or a
important
brain
for
surgery.
children in any situation, especially when they are in new surrounding. And so when they have some serious issue and they have to go to the hospital. And the question, so the environment for treating children needs to be made different from that for treating adults. Why? And how can it be made different? What can we do?
Ma'am, as we know, children, they are not very used to the outside environment other than the house. They like we all know, they live with their parents all the time. Most of the time, they live with their parents in their house, around their toys, around people they know. But when they go in the outside world or any environment which is not familiar, they mostly get scared or frightened. So it's very important for them to make the environment safe and children friendly. So that's why we can see in the many of the pediatric wards or children wards, there are different pictures, there are cartoons, there are toys to make them feel like home. And that also
Ma'am,
helps in the
One of the
treatment
main
May I?
term why a
progress
child
of the.
should. Oh yeah.
Let me
please
finish.
Yeah.
Yes,
complete.
Paraj, please.
Yes, ma'am. Ma'am, actually, I'm talking about the children, ma'am. Children are very easily distracted. So that's why their ward should be made in such a particular environment, which is very distracting. That's why when we go to a particular children's ward, ma'am, we see different colors, different, I mean, walls painted in different colors, different articles, different color, different shape, different toys. So according to me,
So we've lost connection.
it's quite easy, ma'am. Ma'am, can you hear me? Cheating,
Yes,
sorry.
yes, now yes.
Treating children is quite easy because they are easily distracted as compared to adults, ma'am.
Ma'am, may I? I have a different opinion than that of
Okay,
Manish.
Apeksha.
A child cannot express like an adult can. Like they like, if I am feeling pain somewhere in my body, I'll come and tell you directly that I'm feeling pain, I'm having a headache, or I'm maybe having some other issues in my body. But if we talk about a little child, he or she cannot express like how he or she is exactly feeling. And there, one of the most way of expressing is crying. Then the second, which we can, in second way in which he or she can express is the imagination, the magic world that the child has his own way of expressing, his own way of terms. He may say like I have two small siblings. If they are getting hurt, then I do that magic wala thing, and within few seconds that pain goes away. But I know the logic behind that, and they do. So that's the reason why a child should be. It's very difficult. It's like the one of the most difficult area to be handled, because a child cannot express, and if a child needs
Yes.
to feel safe, the doctor needs to understand his or her imagination and what he or she wants to express through that imagination. Or maybe
Okay.
like a doctor needs to understand that the child is saying that there are stars in the sky when I sleep, when I wake up, means that the child wants to say that he or she is having what we say hallucinations. He or she, there can be very different ways of expressing. It's just an example, but yeah, it's
Okay,
very
thank you
difficult to
so
teach a
much.
child.
I see that you've got a very big experience in just dealing with little
That's
children.
because of I have three small siblings. One is
Yes.
Misha, and I have two twins.
I
It's a great
see.
experience.
Great. Very good. And let us focus on some statistics about just little patients. So you can see that in the United Kingdom, this is statistics about the United Kingdom, patients who are less than 15 years of age, they make up 20% of the average GP practice in the United Kingdom. So 20%. And so the patients under 4 years old, the under 4's patients consult their GP more than any other age group except the elderly. So of course, I understand that we do not have the exact statistics. So, but what's your opinion? What do you think? Is this pattern the same in your country?
Ma'am, it is almost same, not talking about this 15-year age group, ma'am, because we have a working age group which is from 20 to 18 to 25, 35 years, ma'am. So I think, ma'am, the main average will be for our ages will be 18 to 35. But when we talk about the under 4's patient, ma'am, this is true, ma'am. They are the most consulting. I mean, their number is the most when they talk about a GP consult. In our country, ma'am, because children are given very priority, ma'am. People in India are very afraid. They get really afraid. Even if a child is suffering from cold and is crying, they are like, "What's happening? Why is he crying?" So they'll take him to the doctor. So this is true, ma'am. The second point.
There's a reason why a child is taken to the doctor, because the parents themselves cannot sometimes understand what the child is feeling. He or she is crying continuously. This can be something serious. So they are like the most consulting to the doctors, because doctors have seen that situation. Doctors understand why the child is crying. That's
Okay.
this is the reason why mostly under 4 patients are.
Yes, I
And
see.
then
So,
Ma'am, there are
Vandana,
some conditions. Yes, ma'am. Ma'am, in some condition, even the children don't understand what kind of pain or what kind of problem they're having. So they start crying. And even parents think maybe sometimes it's serious, sometimes it's non-serious, sometimes they're ignored. But most of the time, parents, they take it seriously, because children are not that used to express their pain. So they prefer to take them to doctors most of the time.
So they are worried, of course, yeah. Okay, thank you. And so the question, which areas do you think should have priority in any modern health spending? Child health, geriatrics, or technology? Let us speak about these 3 categories. So which of them should have priority in spending?
Ma'am, may I?
Yes, please.
Ma'am, according to me, ma'am, we have to give priority to first the technology. Ma'am, because with technology we detect anything like ma'am, nowadays children is not able to express their pain or ma'am any issue, but ma'am, in the upcoming time, like if we have such a technology that we detect it, ma'am, we detect the issue with the children with the help of that technology. So I think, ma'am, technology will be the first priority
I
for
see.
modern. Yeah.
Thank you. So
According to me, child health should be given the more priority.
why?
I could compare it with the other. Like if we talk about the technology, it was like it is a newly processed thing. Even today, there are new technologies which are found. But even in ancient times, like old times, patients were cured. Yeah, not so much difference was there, but yeah, people were cured with or without technology in the past. So somewhere I think child health is more important because a child cannot be able to express. Even if we talk about the old ages, that is a geriatrics, they are able to express, they are able to what we say, there can be something, they have lived their life, their whole life has been lived, and now they are in their what we say, the golden era. But the child is like he or she has to suffer it with the whole lifetime.
I see.
If it
Okay.
is treated.
Ma'am,
Ma'am, may
Yes.
I add?
Just
Ma'am,
Vandana raised her hand. Yes, Vandana.
Yes, ma'am. Ma'am, according to me, I would agree with Shoaib, because if the technology is good and it's like we can say it can detect all the problems in advance, and it will affect on the like both the factors, child health and geriatrics. So if the technology is good, there are chances there will be less problems of these both cases. If the technology is good, if the facilities are good, there are chances there won't be any need for considering these factors anymore.
Okay. So anyone else would like to speak about this?
yes, ma'am. I
Yes,
had seen
ma'am.
Yes, please.
with Vandana and
Priyesh.
Shoaib. Ma'am, actually, when we're talking about technology, it isn't particularly that this technology will only be used for geriatrics or it will be only used for oncology or it will only be used for pediatrics. So when we talk about technology, ma'am, it is a general term. That's why giving priority to technology is important. As if we advance in technology, that will be applied to child health as well. And if we talk about some modern technologies, ma'am, most of the things like endoscopy and all, ma'am, MRI, X-ray, they have created a vast difference. Like earlier, we used to actually think that yeah, this child is suffering from liver swelling, and it was really tough to actually examine it from outside palpation and then do treatment, hit and trial method. It was really fatal, ma'am. But after this technology advanced, ma'am, these things are quite easy. They just send us for a report. I mean, for just for a test, we go and we get it done, even for a child or for a older patient. And ma'am, that's why, ma'am, I think technology should be given foremost priority, then child health, and then geriatrics, ma'am.
I see. I see. So you are very clear in your just explanation. Okay, let us go on. And so here, let us focus on the qualities of a good pediatrician. Here on this slide, you can see a table. A table just with some adjectives that describe qualities of people, of a doctor. So there are two columns here, positive adjectives and negative adjectives. And so we should complete the gaps in this table, because you can see that the adjectives are given in pairs. One of them is positive, the other should be should have the opposite meaning. Like, so if we have a look at the first line here, there is patient, and what is the corresponding negative adjective?
Impatient.
Doctor.
Impatient. Yes, we can just
Agitated.
Impatient.
yes.
Agitated.
Okay, or we can just easily just make it negative with the help of the prefix. So it works in most of the cases here. So please, just a couple of minutes for you to write down these adjectives in pairs as they go in the table, because we'll need them later to work with the exercise. So please write them in pairs. 2 minutes for you.
Inefficient.
See? Congratulations. Okay, so let us check what we've done. Let us listen to Aman. Read the adjectives in pairs, please.
Patient, impatient,
Then read all of them,
dependent,
please.
nervous,
So
confident,
confident, okay.
efficient, inefficient, reliable, untrustable, unreliable,
Unreliable. Mhm.
sensitive, sensitive, insensitive, cruel, honest, dishonest, disrespectful, respectful,
Yes, respectful, disrespectful. Okay, thank you. So now let us just use the adjectives, some of them in the situations which are suggested here on this slide. So we should complete the sentences using an appropriate adjective from the table. Let us have a look at the first situation and think of the qualities that Dr. Manson has. So
Confident.
just Nivas, are you here?
Yes, ma'am.
So please read the first
Yes, ma'am.
sentence. Mhm.
Okay. Ma'am, first sentence is Dr. Manosor is very confident in everything she does. She prepares for her ward rounds methodically, and everything is where it should be and in order.
So which adjective?
Efficient should be the answer, I guess,
Efficient.
rather than confident.
Does everyone agree that efficient should be used here?
Yes, ma'am.
Ma'am, I think
And we can
confidence
use
is.
both.
Okay, so let us just agree on efficient. So please read the other sentences and think of the adjective which is missing in each of the sentences. So 3 minutes, please.
May I read second point?
Just let us do it individually. Everyone will do, and then we'll check in 3 minutes, okay? Okay, let us check what we've done. And now, Rakhav. Let us listen to Rakhav. Is Rakhav here?
No, ma'am.
He's absent. Ujjwal?
Yes, ma'am. And second question.
Yes.
Dr. Mubarak is a very impatient sort of a person. He does things quickly and often makes the parents and children nervous by showing he wants the consultation to end. The answer is
Yes.
impatient.
Impatient, yes, thank you. So, Sayonika, please.
Dr. Andrew is very dash to all patients. He greets them properly and takes their wishes into accounts.
Yes, missing.
Very reliable.
Oh, so this is about just
Respectful.
yes, just dealing with
Yes, ma'am. Respectful.
respectful is better to use here. Okay.
Yes, ma'am.
Respectful.
Rohit, is Rohit here? No, minus. Ritik, please.
Impatient.
Yes,
Yes, ma'am.
Ritik. Mhm.
Dr. Chandos is not very honest with himself. He finds it difficult to admit his weakness while showing off his strength. Being realistic and about weakness helps us to learn and develop our skills.
Mhm. So it's
Answer
very
is honest.
yes. Honest. You see that this is the just the idea about being realistic about weaknesses. So we should also think about our weaknesses just to be able to develop and educate ourselves. Okay, the
Yes,
next
ma'am.
is for Mohammed, please.
Yes, ma'am. Ma'am, my colleague can be very dash. She annoyed the patient with she suffered to her husband. And ma'am, I think disrespectful. My colleague can be very disrespectful. She annoyed the patient with she annoyed the patient when she referred to her husband and she was not married. The patient was quite upset.
Ma'am,
Ma'am,
it
disrespectful.
insensitive can also be the answer.
Insensitive. I think insensitive is
Yeah, ma'am.
better. So because insensitive, this is a kind of empathy to the patients, understanding their feelings. So being
Yeah, ma'am, yes, ma'am,
sensitive,
yes.
and she's insensitive in this situation. Okay, so the next is for Apeksha.
Yes, ma'am. It is not easy to feel confident the first time you do something new, but with practice, you begin to feel very good about it.
Great. And then Misha.
Yes, ma'am. Dr. Kamara sensed that the team thought that she was unreliable because she let them down and she made mistakes on the ward and was late for the several occasions.
Yes, we can't rely on this person. This person is unreliable. I see. Okay. And so we've just listed some qualities of a good doctor. What about other qualities that you think a good doctor, not just a pediatrician, needs to have? And say why each quality is essential. What can you add to this list of good qualities?
May I-
Yes?
Ma'am, talking about doctors, especially pediatrics, ma'am, being patient is the most important quality one should have, ma'am. Because when we are dealing with children, ma'am, when we are dealing with children, or I mean, when we are dealing with patients, ma'am, it gets really hectic because sometimes patients aren't able to express their thing, especially children. So rather than being impulsive or being impatient, if we closely look at the situation, analyze it, and then we do things, it will be fruitful. That's why being patient is the most important thing for a doctor, ma'am.
But we are speaking about other qualities which were not mentioned. Other qualities.
Ma'am,
Ma'am,
being humble should be prioritized.
Sorry, will you repeat, please?
Ma'am, being humble, the doctor should be humble.
Ma'am,
Okay. Yes, please.
according to me, I think a pediatric doctor should be joyful, so that the child is feeling safe with the doctor, and he or she, the doctor, should be understandable that whether the child is feeling scared or nervous, or he or she is happy for the diagnosis what is happened. And the third thing is the respectfulness, not only to the child. The pediatric doctor has two main roles. First priority is the child itself, diagnosing and treating the child, and second is the parents, because along with the child the parents are also as much as nervous and they are scared. So
Exactly.
it is really very important for pediatric doctor to make the parents feel comfortable that they are trying their best, and they should not do any disrespectfulness in front of the parents.
Okay,
That
thank
is
you. So what else, please? So it seems like we have just spoken about everything, yes? The essential skills. And okay, and yes, there is a question. Are there any qualities that a pediatrician needs to have more than other doctors?
Friendliness is something which is very necessary for a pediatrician. Friendliness, along with that,
Understanding.
believing in the child's fantasy, like even in believing like that the injection is a sword, or maybe we can say that a syringe is something, like the imagination of the child and making the child comfortable is very important. The interaction between the patient and the doctor, interaction skills are very necessary for the doctor when he or she is a pediatrician.
And in the situation when a child is scared of the instruments, when the child comes to the hospital and so needs to, the procedure, some kind of procedure should be done. So what are the qualities that pediatricians should have just to deal in this situation?
Ma'am, along with the interaction skills, the patient, the doctor should know how to distract the child.
Yes.
Like any toy or something on their collar, or maybe we can say that nice magic one stethoscope,
Yes,
which can distract the child. Within that period of time, the procedure can be taken.
Okay, good.
May I?
Yes, please.
Ma'am, I think, ma'am, the doctor can use different colorful syringe, ma'am. There are syringe which come like, ma'am, Avenger syringe and all, ma'am. What happens is when we were child, ma'am, actually we can talk about the situation when we get a new pencil or a new form of pen. So what we did, ma'am, even if we didn't wanted to study, we we used to study, we used to scribble with that pen, and we somewhere we used to study. So that distraction is important. If we present them with some different kind of syringe, ma'am, they'll feel less afraid, and they'll like to try it. That, yeah, see, I'm getting jabbed through through Avengers syringe. So I'm very excited. So there are chances children will like these type of things, ma'am. We can use this, ma'am, as an initiative.
I see. So that is why you just want to be a doctor, yes? So it comes from your childhood. I see.
Yes,
Yes. Yes, please.
And I can say with the doctors, the pediatric doctor should be more understanding towards the children, as he should be able to connect with the children.
Okay. Yes, great.
And also in some situation they need not to be hypocritic. Yes,
I
ma'am.
see. I see. A lot of very interesting ideas. So it looks like we have so about 1 minute left. So that is why it makes sense to